Recent CPR guidelines have been updated with key changes to improve the effectiveness of this life-saving technique. The compression-to-breathe ratio has been revised to 30 compressions to 2 breaths. This update is a change from the previous recommendation of 15 compressions to 2 breaths. It is now considered essential to immediately call emergency medical services, or EMS, before beginning CPR. The main goal of CPR is to keep the brain supplied with oxygen until professional medical help arrives. CPR certification provides many benefits, especially in workplace environment. Firstly, it significantly increases the likelihood of survival for a victim experiencing cardiac arrest. Trained personnel can start CPR quickly, which greatly improves the person's chances of survival. Secondly, having CPR certified individuals creates a safer work environment. The presence of people trained to respond in an emergency can provide reassurance and peace of mind to everyone. In conclusion, the updates to CPR guidelines and the benefits of certification are intended to empower individuals to make a real difference in emergency situations. This knowledge equips workplaces to respond more effectively to cardiac events. Encouraging CPR training and maintaining certifications helps organizations build a safer and more supportive environment for everyone. It's important to stay current with the latest CPR guidelines, which are regularly updated based on the most recent medical research. These updates often include changes to compression depth, hand placement, and ventilation techniques. Proper training is crucial to ensure that CPR is performed correctly and effectively. Participating in regular refresher courses is recommended to maintain proficiency and confidence in performing CPR. Learning CPR is not just a valuable skill for the workplace, it's also essential for personal preparedness. Cardiac arrest can happen anywhere, at any time, and knowing CPR can enable you to help a family member, friend, or stranger in need. Bystander CPR significantly increases the chances of survival for cardiac arrest victims. The more people who are trained in CPR, the more likely someone will be able to respond quickly and effectively in an emergency. In addition to compressions and breaths, it's important to be aware of other important aspects of CPR, such as checking for responsiveness and calling for help. When you encounter someone who is unresponsive, the first step is to check for signs of breathing or a pulse. If the person is not breathing or has no pulse, immediately call emergency services or ask someone else to do so. Once emergency services have been contacted, begin chest compressions. Place your hands in the center of the person's chest and compress down at least 2 inches, but no more than 2.4 inches, at a rate of 100 to 120 compressions per minute. After every 30 compressions, give 2 rescue breaths. Tilt the person's head back and lift their chin to open their airway. Pinch their nose closed and create a tight seal over their mouth with your mouth. Give 2 breaths each lasting about 1 second. Continue cycles of compressions and breaths until emergency medical services arrive or the person shows signs of recovery. It is important to note that even if you are not certified in CPR, you can still provide assistance by performing chest compressions. Hands-only CPR, which involves only chest compressions without rescue breaths, has been shown to be effective in some situations. If you are not comfortable giving rescue breaths, focus on providing continuous chest compressions until help arrives. Remember that any attempt to provide assistance is better than doing nothing at all. CPR is a critical skill that can save lives. By staying informed about the latest guidelines and practicing regularly, you can be prepared to respond effectively in an emergency. The American Heart Association and the American Red Cross are excellent resources for CPR training and certification. Taking a CPR class will provide you with the knowledge and skills you need to confidently respond to a cardiac arrest. In addition to CPR, it's also important to be aware of other life-saving techniques, such as the Jaime maneuver for choking victims and how to use an automated external defibrillator, also known as an AED. AED are portable devices that can deliver an electrical shock to the heart to restore normal rhythm. AED are becoming increasingly common in public places, such as schools, airports, and shopping malls. Learning how to use an AED can further enhance your ability to respond to a cardiac emergency. Remember, time is of the essence when someone is experiencing cardiac arrest. The sooner CPR is started, the greater the chance of survival. Be prepared, stay informed, and empower yourself with the knowledge and skills to save a life. Continuous chest compressions are a vital part of CPR because they help circulate blood to the brain and other vital organs. The depth and rate of compressions are important factors in ensuring effective blood flow. Compressing the chest at least 2 inches, but no more than 2.4 inches, allows for adequate blood flow to the heart and brain. Compressing at a rate of 100 to 120 compressions per minute helps maintain consistent blood flow. It's important to avoid interruptions in chest compressions, as any pause can reduce blood flow and decrease the chances of survival. If you become fatigued while performing CPR, switch with another trained rescuer to maintain continuous compressions. Rescue breaths provide oxygen to the lungs, which is then circulated to the rest of the body. Giving 2 breaths after every 30 compressions helps replenish oxygen levels in the blood. Each breath should be delivered over 1 second, with enough air to make the chest rise visibly. Avoid giving breaths too forcefully or quickly, as this can cause air to enter the stomach instead of the lungs. If the person's chest does not rise with each breath, check the airway and ensure that it is open. Proper airway management is essential for effective rescue breaths. Tilting the person's head back and lifting their chin helps to open the airway and allow air to flow freely into the lungs. If you suspect a spinal injury, use a jaw thrust maneuver instead of a head tilt chin lift. To perform a jaw thrust, place your fingers behind the angles of the person's jaw and lift the jaw forward. This maneuver helps to open the airway without moving the head or neck. Using an automated external defibrillator, or AED, can significantly improve the chances of survival for someone experiencing sudden cardiac arrest. AED are designed to be used by laypersons and provide clear step-by-step instructions. When using an AED, first turn on the device and follow the prompts. The AED will instruct you to attach the pads to the person's chest. 1 pad should be placed on the upper right side of the chest, and the other pad should be placed on the lower left side of the chest. Once the pads are attached, the AED will analyze the person's heart rhythm. If the AED detects a shockable rhythm, it will advise you to deliver a shock. Before delivering the shock, make sure that no one is touching the person. Press the shock button and wait for the AED to deliver the shock. After the shock is delivered, immediately resume CPR, starting with chest compressions. Continue CPR until emergency medical services arrive or the AED prompts you to stop. It's important to remember that AED are designed to be used in conjunction with CPR. CPR helps to circulate blood to the brain and heart, while the AED delivers an electrical shock to restore a normal heart rhythm. Both CPR and AED use are essential for maximizing the chances of survival for sudden cardiac arrest victims. Staying up to date on the latest CPR guidelines and practicing regularly is crucial for maintaining proficiency in these life-saving skills. Consider taking a CPR refresher course every year or two to ensure that you are prepared to respond effectively in an emergency. The American Heart Association and the American Red Cross offer a variety of CPR training courses to suit different needs and schedules. By investing in CPR training, you are not only empowering yourself with valuable skills, but also contributing to a safer and more prepared community. The information provided is intended for educational purposes only and should not be considered a substitute for professional medical advice. Always seek the advice of a qualified healthcare provider for any questions you may have regarding a medical condition. In addition to the points already discussed, it's worth noting the importance of early recognition of cardiac arrest. Recognizing the signs and symptoms of cardiac arrest quickly can help ensure a faster response and improve the chances of survival. The most common signs of cardiac arrest include sudden loss of consciousness, absence of breathing, and absence of a pulse. If you witness someone suddenly collapse and exhibit these signs, immediately call for help and begin CPR. Do not hesitate to act, as every second counts. Even if you are not completely sure whether someone is in cardiac arrest, it's better to err on the side of caution and start CPR. The potential benefits of CPR far outweigh the risks of performing it unnecessarily. Remember, you don't need to be a medical professional to save a life. With proper training and a willingness to act, you can make a real difference in an emergency situation. Furthermore, it's crucial to remember that CPR is not a substitute for definitive medical care. CPR is a temporary measure that helps to keep the brain and other vital organs alive until emergency medical services arrive. Once emergency medical services arrive, they will take over the care of the patient and provide more advanced medical treatment. The ultimate goal of CPR is to buy time until definitive medical care can be provided. In addition to hands-on training, there are many online resources available that can help you learn more about CPR and ED use. The American Heart Association and the American Red Cross websites offer a wealth of information, including videos, articles, and interactive tools. These resources can be a valuable supplement to hands-on training and can help you stay up to date on the latest guidelines and recommendations. Moreover, consider encouraging your family, friends, and colleagues to get CPR certified. The more people who are trained in CPR, the more likely someone will be able to respond quickly and effectively in an emergency. By creating a community of trained responders, you can significantly increase the chances of survival for cardiac arrest victims. CPR is a skill that everyone should learn, regardless of their age, background, or profession. It's a skill that can empower you to save a life and make a positive impact on your community. Remember, being prepared is the best way to respond to an emergency. Take a CPR class, practice your skills regularly, and encourage others to do the same. Together, we can create a safer and more resilient world. Learning CPR is not just about acquiring a new skill, it's about embracing our responsibility to help others in need. It's about being willing to step up and take action when someone's life is on the line. It's about making a commitment to protect and preserve the well-being of our community. When you become CPR certified, you join a network of individuals who are dedicated to saving lives. You become part of a movement that is making a real difference in the world. So take the plunge and get CPR certified today. You'll be glad you did. The knowledge and skills you gain may one day save the life of someone you love. In addition to traditional CPR training, there are also specialized CPR courses available for specific populations such as infants, children, and pregnant women. These courses cover the unique considerations and techniques that are necessary when providing CPR to these vulnerable groups. If you frequently interact with infants or children, or if you are pregnant yourself, consider taking a specialized CPR course to learn how to respond effectively in an emergency situation. Furthermore, it's important to remember that CPR is just one component of a comprehensive emergency response plan. A well-prepared workplace or community should also have protocols in place for other emergencies, such as fires, natural disasters, and active shooter situations. Developing and practicing these protocols can help ensure a coordinated and effective response to any type of emergency. In addition to CPR and first aid training, consider investing in other safety equipment such as fire extinguishers, smoke detectors, and first aid kits. Make sure that these items are readily accessible and that everyone knows how to use them properly. By taking a proactive approach to safety, you can create a safer and more secure environment for everyone. Remember, safety is everyone's responsibility. By working together, we can create a culture of safety that protects and preserves the well-being of our communities. It is also important to note that laws regarding Good Samaritan protection vary by location. These laws are designed to protect individuals who provide emergency assistance to others in good faith. Familiarize yourself with the Good Samaritan laws in your area to understand your rights and responsibilities as a rescuer. Even with Good Samaritan protection, it is important to act reasonably and prudently when providing emergency assistance. Do not attempt to provide care beyond your level of training or expertise. Always prioritize the safety of yourself and others. When in doubt, call for professional medical assistance and follow their instructions. Ultimately, the decision to provide CPR or other emergency assistance is a personal one. Weigh the risks and benefits carefully and act according to your conscience. Remember, even a small act of kindness can make a big difference in someone's life. By being prepared, informed, and willing to help, you can contribute to a safer and more caring world. Remember that while providing CPR, the environment safety is paramount. Ensuring the area is free from immediate hazards like traffic or unstable structures prevents further injury to both the victim and the responder. If hazards are present, attempt to move the victim to a safer location if it can be done without causing additional harm. Communicate clearly with bystanders, directing them to call emergency services, retrieve an AED, or assist with crowd control. Effective communication ensures a coordinated response, maximizing the chances of a positive outcome. After providing CPR, document the incident, including the victim's condition, interventions performed, and the time of events. Accurate documentation aids emergency responders upon their arrival and serves as a valuable record for medical professionals. Reflect on the experience, acknowledging any emotional impact the event may have had. Seek support from colleagues, friends, or mental health professionals to process the experience and maintain well-being. Continuous learning and self-care are essential for maintaining competence and resilience in emergency response. Be aware of legal and ethical considerations surrounding CPR, including consent, abandonment, and scope of practice. Understand your obligations as a responder and adhere to ethical principles to protect the rights and well-being of the victim. Seek legal counsel if needed to clarify any uncertainties or concerns. Engage in community outreach and education to promote CPR awareness and preparedness. Share your knowledge and skills with others, empowering them to become lifesavers in their own communities. By fostering a culture of preparedness, we can collectively enhance our ability to respond effectively to emergencies and save lives. Embrace technological advancements in CPR training, such as simulation-based learning and virtual reality experiences. These innovative approaches offer immersive and engaging training opportunities, enhancing skill acquisition and retention. Stay informed about emerging technologies and incorporate them into CPR training programs to optimize learning outcomes. Advocate for policies and initiatives that support CPR training and access to AED in public places. Encourage policymakers to prioritize funding for emergency medical services and promote legislation that improves cardiac arrest survival rates. By advocating for evidence-based policies, we can create a more supportive and responsive system for cardiac arrest management. Recognize the importance of interprofessional collaboration in cardiac arrest management. Work effectively with emergency medical services, healthcare professionals, and community organizations to coordinate care and improve outcomes. By fostering a collaborative approach, we can optimize the delivery of emergency medical services and enhance the overall system of cardiac arrest management. Remember that CPR is a journey of continuous learning and improvement. Stay curious, seek out new knowledge, and embrace opportunities for professional development. By committing to lifelong learning, we can enhance our skills, expand our knowledge, and ultimately save more lives. Advocate for comprehensive school-based CPR programs to equip students with life-saving skills from an early age. Integrate CPR training into the curriculum and provide ongoing opportunities for students to practice and refine their skills. By empowering students with CPR knowledge, we can create a generation of lifesavers who are prepared to respond effectively to emergencies. Remember that CPR is not just a skill, it's a gift. It's the gift of life, hope, and compassion. By sharing this gift with others, we can create a world where everyone has the chance to survive cardiac arrest and live a full and meaningful life. And always seek counsel from properly qualified persons, especially about one's fitness to provide CPR.